Nancy, I'd like to begin with you. It's a question about government and structure and the White House response. Is the White House okay with 50 governors, some more than others, taking the lead on this?
Well, I think that what the White House in the last week has really been trying to do is shift a lot of the authority and the responsibility for the response to governors. I've talked with a number of senior administration officials in the last week, and they're really trying to say that it's up to governors to get the resources that they need. If they're resourceful and they're strong leaders, that they'll be able to get that, and that the White House is really just there to offer a backstop. And so that's what I'm hearing from senior administration officials. I do think the view from the governors is much different. They're saying that we can't be in competition with one another for these key medical supplies. Some governors are begging for protective equipment. And we're seeing really harrowing tales out of hospitals in places like New York, where there's a shortage and where I think that people want more leadership from the federal government and more leadership for Trump, when in fact, usually at these press conferences that he has every day, there's a lot of happy talk about things that are happening, these public-private partnerships, the test capacity being ramped up, which he's exaggerating. And so I think that we're seeing a real disconnect between what the governors are saying they need and what they're telling people and what the White House is trumpeting.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.